Hypertension in children and adults both should be controlled on the low normal side because of persistent elevation of blood pressure when it shoots may cause organ damage. So thereby a patient known to have lifelong hypertension, as in the case of essential hypertension, renal hypertension, metabolic syndrome with hypertension, they should have control of BP on lower normal side, and patient who has renal involvement, proteinuria cases, they should have also further lower 50 centile in pediatric population, and adult population may be 75th centile, above 13 years and above, an adult and adolescents. So they should have BP of adult figure how much? Systolic 90 to 115, not by any circumstances more than 120, and diastolic BP between 55 to 75 or so, not above 80 millimeter of mercury by any means. So, and they should be controlled with a drug known to cause the human friendly, like ACE inhibitor and ARB. ACE inhibitor is a drug which inhibits the aldosterone 2, and that's why it prevents the your fibrosis and CKD progression and organ damage in various sites. And also the ARB, it blocks the receptor, as the name suggests. Receptor means aldosterone receptors, AT2. Thereby, they are the drug which helps in the end organ damage and progression of the organ damage. Thereby these two are either of these two, not two together, because use of this together has been found to reduce BP by only 3 to 4 millimeter of mercury, but and then concomitant use has been found to have hyperkalemia and little bit raised creatinine. So thereby it's nice to have one drug and good amount of time in the most you have combined therapy. It's good, and then you use ACE inhibitor or ARB, either of the two, one, two maybe beta blocker, three maybe someone else. By this time your BP is controlled, and go on maintaining it for lifelong. Apart from the lifelong blood pressure control, lifestyle modification, diet, dash diet, your less shade, less fat, less sugar, less salt, and then exercise 3 hours in a week, and smoking avoidance, and healthy lifestyle, weight control, blood sugar control, and your other parameters, good sleep, that can have greater longevity in hypertensive people.